how do we develop Parkinson's services? It's a bit like a game of snakes and ladders. And it seems to me that the snakes are really significant. The increasing demand, the increasing expectations, doing a lot more with a lot less resource.
In the NHS as it stands at the moment, there isn't a lot of extra resource out there. So it's very important to make the most of what we have already.
There aren't that many physios who are specialised in Parkinson's.
People with Parkinson's disease sadly often don't get access to a speech and language therapist.
It's essential that, Parkinson's gets a high profile.
We look at the newspapers and we see crisis in A&E or issues around cancer, and that's where the focus is. So those snakes, they really stop us.
And at the end of the day, we need to remember why we're there, and we're there for our patients.
Starting with the patient and then developing and designing the services around them is where we're going to have to go.
There's an awful lot of people doing an awful lot of good in Parkinson's disease, but people are working in their own little silos.
Some wonderful pockets of excellence, but it's not consistent.
At the end of the day, patients live in localities. They don't travel to London for their care necessarily.
So I see the UK Parkinson's Excellence Network as a glorious opportunity to take wonderful ideas from professionals from all over the country to share and disseminate more widely, to reach out to other professionals locally and across the UK, so no one need feel professionally isolated.
The problem is I have a head full of clinical experiences which I have never been able to share with anyone else.
And we're all sometimes reinventing the wheel, and that can be avoided.
Finding better ways to work together.
Standardisation of care. Sharing what's really good about the way we work.
Sharing innovative practice.
Sharing expertise and best practice.
We can save time and effort by not reinventing the wheel, building an expert workforce. We're all in this together.
And it allows me to tap into other people's experience and expertise.
Link with all the other specialists nationally.
That's going to drive standards upwards.
Everybody who says they've got a passion and interest in Parkinson's, you can be involved in this. And together we'll raise the bar, together we'll share best practice, together we'll learn and explore what it means to provide a good service.
I think it's a really exciting new adventure.
I think it's something that's really important.
It's a great thing.
An inspirational view of the future.
For better outcomes for people with Parkinson's.
It can only be a good thing for patients, generally improve care for everybody.
Make a real difference in our own communities.
I think it gives patients a much louder voice.
My patients are going to get everything that they deserve.
That's what we're all about.
I feel re-energised.
It's great to be part of it.
It isn't our excellence network, it's your excellence network. You're the people with the ideas and the energy to make this happen.
We're going to raise the bar so that every person with Parkinson's gets the high quality standard of care. We're only going to achieve this if you're prepared to get involved and to encourage your colleagues to get involved.